Okay, good morning, everybody. Dr. Arafit from Vet Triage, October 12th, 9:14 a.m. Pacific time. We are, boom, JAVMA. This is the May 15, 2015 edition, and we are going to talk about horse colic, the effects of preoperative administration of hypertonic saline or pentastarch solution on hematologic variables and long-term survival of surgically managed horses with colic. So this review is going to require that you know a lot of the basic like cardiovascular, hemodynamic, excuse me, saline solutions, things like that. That I can't go into too much detail. I'll try to hit them, but you'll have to have some basic knowledge of that. And this is out of England, two different universities. So the objective was to compare the effects of preoperatively administered pentastarch in a 10% concentration in isotonic saline, which is 0.9% sodium chloride, and hypertonic saline, which is 7.2% sodium chloride, and to compare those solutions on the packed cell volume and circulating total protein in horses with colic undergoing emergency abdominal surgery, and then assess survival after each treatment. They had 100 horses that had signs of colic, so abdominal pain, and had a packed cell volume of at least 0.46 liters per liter or greater. During the experiment, the horses received 4 mils per kg, which is 1.8 mil per pound dose of pentastarch solution. That's half of the horses, or the other half received hypertonic saline solution over a 10 to 20 minute period before anesthetic induction. Results: hypertonic saline solution treatment resulted in significantly greater reduction in packed cell volume and total protein. However, long-term survival was not significant between the two groups. Therefore, even though the hypertonic saline solution seemed to have a better result with the hemodilution than pentastarch, they said here that in a clinical setting, either of these fluids would be appropriate for preoperative fluid resuscitation in horses with colic because there is no long-term survival benefit. There you go. All right, let's get into the details. They start off with saying that hypovolemia and dehydration can be further complicated by endotoxemia. Now, hypovolemia means a lower volume in the vasculature, which is different than dehydration. Dehydration is more of a superficial loss of blood of fluid volume in the bloodstream, and you typically see dehydration in animals with dry gums, or they have tenting of the skin. Perhaps they have tachycardia or a fast heart rate, whereas hypovolemia, I think, includes dehydration, but it also involves the deeper vasculature in the animal. So things like poor perfusion to the organs, for example, is an example of that. So they're not the same thing, but we tend to use hypovolemia and dehydration synonymously. And those two things can be further complicated by endotoxemia. Endotoxin is a chemical found in gram-negative bacteria, and when gram-negative bacteria are destroyed by antibiotics or by the immune system, or they are undergoing reproduction, they release endotoxin. Endotoxin is toxic to the body. Preoperative hemodynamic resuscitation is warranted in such patients where practical to improve their cardiovascular reserves and reduce the risks of anesthetic complications. Hemoconcentration is common in horses with colic and has been shown as indicator of severe cardiovascular compromise and prognosis. So hemoconcentration is characterized by packed cell volume and total protein. If there's less fluid in the vasculature, then the percent red blood cell mass, which is packed red cell volume or packed cell volume, goes up, and total protein protein in the vasculature will also go up. Horses with a packed cell volume of over 45 to 50 liters per liter have a poor prognosis. Hemoconcentration increases blood viscosity. So there's a triad, and I'm going to have a hard time remembering it, that looks at the viscosity of blood, I think endothelial damage, so lining of the blood vessels, and then I believe the platelets or blood cells being low. but those three parameters of viscosity, cell density, and vascular damage makes a patient prone to becoming coagulopathic, so they can create blood clots inappropriately. So blood viscosity may play a role in that. With colic and hemodynamic compromise, the goals of these therapies is to improve cardiovascular function and lower the hematocrit. Hematocrit is percent red blood cell mass. An administration of large volumes of crystalloids prior to surgery may have detrimental effects. They might promote intestinal edema formation. They might promote third spacing of fluid in the GI tract. When you have interstitial edema forming, it compromises tissue oxygen delivery. And when you have third spacing of fluid, especially in the GI tract, it can increase the risk of bowel rupture or complicate anesthesia by increasing the weight of the abdominal organs, pushing on the vena cava and aorta when horses are in dorsal recumbency, which of course could worsen the cardiovascular status. So the trend lately has been for small volume fluid resuscitation to try and minimize those effects. And then these treatments usually require follow-up administration of isotonic or even sometimes hypotonic fluids, such as Hartmann solution, which is lactated Ringer solution. Okay, whereas hypertonic saline has a profound but relatively transient effect on hemodynamic and variables. So these effects from hypertonic saline last between 30 and 120 minutes. Colloids, especially hydroxyl ethyl substituted starches, have a more sustained effect. So in brief, you have two broad categories of fluids you can give animals. You have those that are balanced with the normal electrolytes in the body, and you have those that are not balanced, that either are hypertonic, meaning they have higher values that in the bloodstream, or hypotonic, which are lower. Or you can use proteins like colloids, for example. Other protein examples include blood transfusions, and they may have a longer lasting effect in the bloodstream. The reason why you see a transient effect, we're going to go into a tangent here, is with hypertonic, hypotonic, or isotonic salines, the fluid and the electrolytes are going to rebalance very quickly in the bloodstream because these are compounds that are pretty similar to the viscosity of normal blood. Whereas if you look at the colloids, they are larger chemicals, larger compounds, so they're going to stay in the intravascular space for a longer period of time, and therefore they will have their effects for a longer period of time. Horses with colic, the more severe the cardiovascular disturbances, the worse the prognosis, the greater the degree of endotoxemia, also affects the prognosis. So fluid resuscitation before, during, after surgery become inadequate in these situations, or if they are inadequate, it can affect prognosis. In one study, preoperative administration of hypertonic saline in horses with colic had a poorer short-term survival, but it was found to be non-significant, so they wanted to do this paper. This paper looked at horses between 2004 and 2008 that had abdominal pain and a packed cell volume of at least 0.46 liter per liter. It has been shown in previous studies that horses with a greater than 0.45 liter per liter packed cell volume had a worse prognosis. They used pentastarch in this study, 10% pentastarch, or 7.2% sodium chloride, which is hypertonic saline. They dosed it at 4 mils per kg. They gave it over 10 and 20 minutes before surgery. The pentastarch treatment was a 200/0.5 solution, so a hydroxyethyl starch with a molecular weight of 200 and a molar substitution of 0.5, and that was given in isotonic saline. No other fluids were given. Long-term survival was looked at for these horses 4 years post-operatively. Let's get into the results. They looked at different colic types, or they had different colic types in this paper. And this is my biggest issue with this paper, is that they did not mention in their conclusion that maybe different colic types could have affected the prognosis. They do mention here that epiploic foramen entrapment colics have a poor prognosis based on prior literature, but they didn't say here that the different types of colics may have affected horse survival. But in any case, for educational purposes, let's go over different types of colics in the study. These include epiploic foramen entrapment, small intestinal disease, dysautonomia, ileal or large bowel impaction, large colon torsion. Others included peritonitis, fecaliths, idiopathic focal eosinophilic enteritis, large bowel displacements, anterior enteritis, colitis, and adhesions. Horses in each treatment group received approximately 10 liters of Hartmann solution, which is lactated ringer solution, during surgery, and there was no significant difference between the groups and with that variable. So then they found that the packed cell volume and total protein concentrations were significantly reduced, more so with the hypertonic saline than the pentastarch. The hypertonic saline decreased packed cell volume by a median of 0.13 liter per liter, which is about a 25% reduction. That's huge. The pentastarch group lowered it by 0.07 liter per liter, which is about a 14% reduction, so almost half of the hypertonic saline solution group. Total protein was reduced by a median of 16 gram per liter, which is a 24% reduction with the hypertonic saline group. And with the pentastarch group, it was a 2 gram per liter reduction, which is about a 4%, so much less, about a 1/6. But even though those two parameters were significantly lowered by hypertonic saline, it did not affect long-term survival. When they took out the horses that died or had to be put to sleep in this study, and then reassessed the decrease in packed cell volume and total protein between hypertonic saline and pentastarch, they found that the packed cell volume decreased by 0.14 liter per liter, which is a 25% decrease with hypertonic saline, versus pentastarch, which had a 0.07 liter per liter reduction, which is about a 13% reduction. And then when you look at total protein, hypertonic saline decreased it by 22%. So that's a median of 15.5 gram per liter. And the pentastarch group reduced it by 4%, which is a decrease in 2 grams per liter. So pretty similar, even if you take out the horses that died or were euthanized. But there were no significant changes with long-term survival. Okay, finally, discussion. Hemoconcentration is common in horses with colic and can be attributable by several causes. These causes include dehydration following reduced oral intake, loss of fluid through sweat and sequestration in the GI lumen, fluid redistribution from the intravascular to the interstitial compartment, and endotoxemia, which triggers a systemic inflammatory response. Also, splenic contraction, which accompanies the sympathetic response to hypovolemia, pain, and distress. Regardless of the cause, hemoconcentration causes an increase in blood viscosity, which increases cardiac workload and may compromise perfusion, especially in the microvascular space. It's said here in previous studies, optimal microvascular oxygen delivery occurs with a packed cell volume of 30 to 35%. In dogs, the volume expansion effect of a similar concentration of hypertonic saline solution has been reported as approximately 3 times that attributable to the volume administered. So a 300% increase in intravascular volume with hypertonic saline. That's crazy. Maximum volume expansion effects of approximately 140% were seen with 6% dextran 70 solution and 150% for 6% hetastarch solution. So it shows that hypertonic saline in dogs also has a greater expansion of intravascular volume than using colloids. So a decrease in packed cell volume might be explained by several things. Number one, erythrocyte crenation, which is shrinkage. And this could affect the packed cell volume when you're running the sample in the centrifuge. And this occurs in the presence of increased plasma tonicity. So just to explain that. So increased plasma tonicity means there's a higher concentration of sodium and chloride in the bloodstream. And that's because you gave hypertonic saline, which is higher sodium and chloride concentration. Well, if you have that happen, then fluid leaves red blood cells, right, to try and balance out the high concentration of electrolytes. It leaves red blood cells to lower that sodium and chloride in the intravascular space, but red blood cells then start to shrink because they're losing fluid, and that can affect packed cell volume. Equine erythrocytes contain high concentrations of potassium, and like human erythrocytes, are more susceptible to the volume changes in the presence of plasma osmolality than that of dogs. Blood viscosity depends on red blood cell count, erythrocyte mechanical properties, plasma viscosity, and temperature. Okay, that's what I was talking about before with the triangle. Red blood cell count, erythrocyte mechanical properties, so how deformable are they and are they aggregating? Plasma viscosity, and then finally temperature. Blood viscosity is also flow dependent, meaning it's a non-Newtonian fluid. The viscosity of whole blood varies with shear rate. If hypertonic saline solution has a maximum volume expansion effect of 300%, then hydroxyethylated starch products have a maximum volume of nearly 150%. However, it's been reported in previous studies that the maximum effect of hypertonic saline in dogs on their packed cell volume occurs at the end of infusion, whereas maximum blood volume increases following colloid administration 30 minutes after the end of the infusion. So there is some time when you give these products that the redistribution of fluid in the intravascular compartment is going to be different because hypertonic saline and colloids are just different. So the point is that if you measure packed cell volume after giving these products, it matters when you measure it, and with hypertonic saline, you want to measure it right at the end of infusion, but with colloids, you want to measure it like 30 minutes later. And that wasn't done in this study because it's a prospective study. They can't control with those factors. Pentastarch does produce refractometry readings of 75 grams per liter. So hemodilution with this colloid would produce a tendency for refractometer readings to tend towards this value. Considering the median baseline of total protein was approximately 72 grams per liter in both these treatment groups in this study, it's not surprising that there were minimal changes to the readings. And that was like the 4% change. It wasn't very much. Laboratory measurements of plasma proteins and determination of plasma colloid oncotic pressure would have been more useful. The goal of intraoperative support was to avoid hypotension. Hypotension is when the mean arterial blood pressure is less than 70 millimeters of mercury. You also want to avoid hypoxemia, which is defined as arterial partial pressure of oxygen of less than 60 millimeters of mercury. Other studies have shown that hypertonic saline had a more transient effect on hemodynamics than did a 10% pentastarch solution. So it might be expected that further intraoperative cardiovascular support would be needed following preoperative hypertonic saline administration. That makes sense. Another study showed that long-term survival in people was more significantly strongly correlated with the development of complications 30 days after surgery rather than anything that was given preoperative or intraoperatively. So whether or not that's true in horses is yet to be seen. Different types of fluids will have different interactions in the body. So they mention here that the endothelial glycocolics and the immunomodulatory effects might be affected by these products when they're given. Colloids such as hydroxyethyl starches and hypertonic saline can have useful effects during a systemic inflammatory response, although the timing of administration might be important. It should be noted that concerns including kidney toxicity of hydroxyethylated starch solutions at high doses in human patients have affected its availability in the United Kingdom as well as in the United States. So albumin as an alternative colloid might be looking at in horses in the future because it has less of a chance possibly of having kidney toxicity. Nephrotoxicity is also a concern when crystalloids are given in high concentrations. Hyperchloremia causes renal vasoconstriction. It has been shown to reduce gastric mucosal perfusion. Other concerns surround the use of fluids that contain racemic lactate, like lactate ringer solution or Hartmann solution, because the D-lactate isomer has pro-apoptotic effects, meaning that the D-lactate isomer may induce cells to undergo apoptosis, which is basically suicide for the cells. Furthermore, bolus fluid administration for resuscitation may itself have detrimental effects. And that's the end of the study. And so the way that they concluded there with the bolusing is basically, if you give anything in the body, there's always going to be pros and cons to it, right? And so that's true even with something that seems benign like crystalloids, which are isotonic solutions. And that's it, or isotonic, hypotonic, or hypertonic. That's it for that study. We'll be again back tomorrow for another one. Thanks to those who are watching the playback, and we'll see you then. Bye. Bye-bye.